Hello, everybody. Welcome back to a really exciting episode of Ask the Expert. Today, we're here talking to Dr. Sidney Hankerson. He's the co-director of the Columbia University Wellness Center, the assistant professor of psychiatry at Columbia University Irving Medical Center, and a research scientist at the New York State Psychiatric Institute. He's a nationally recognized expert at faith-based mental health services. He's even presented at the White House, the United Nations, and the National Institute of Mental Health, to name a few. He also focuses on reducing the racial and ethnic disparities in mental health treatment, which I think is so important for us to address today as we talk about spirituality and faith, because it's so culturally based. What I love about Dr. Hankerson's work is his use of culturally tailored motivational interview for church members who screen positive for depression and implementing evidence-based practices for depression in African American churches. I feel like you're someone I could talk to for hours about the work we're doing on our mental health ally certification and our cultural humility learning hubs. But for the sake of our listeners, we'll dive in and we'll try to keep it quick for our podcast. Without further ado, meet Dr. Sidney Hankerson. Thank you so much for being with us today.
Thank you so much for having me, Marjorie. It's truly a pleasure to be here. And thank you for that really wonderful introduction. I'm glad this is being recorded because I don't think my mother would believe that I did all that stuff.
Oh, I have a feeling that everybody around you probably knows they're around greatness. I have no doubt.
It's a great team.
So, just diving right in, what is it about churches that make them so central to promoting and achieving equitable mental health services in communities of color?
Churches are really the bedrock of communities of color generally and the African American community in particular. And this is dated back, for generations. Churches have been, besides historically Black colleges and universities, some of the only institutions really owned by members of the Black community. And in terms of mental health promotion, we know that pastors have provided informal, supports and counseling for years. And my work in this area really was catalyzed by a landmark paper that came out nearly 20 years ago, which showed that across the United States, regardless of a person's racial or ethnic background, or regardless of their religious affiliation, more people who are experiencing depression or anxiety or substance use first seek help from clergy, more so than they seek help from general medical providers or from psychiatrists. So our faith leaders are really frontline mental health professionals. And given the trusted role that churches have in the Black community, I thought that we could leverage that trust and that access to expand upon, the role that they are naturally doing to provide kind of culturally tailored and more evidence-based interventions in faith-based settings.
I couldn't be any more grateful for you for thinking about that and looking at it in that way, because it is so true that people, we know that they go to their faith leaders and they are such an important part. And even though so many of them are naturally gifted at that counseling piece and that real listening, to be able to leverage that makes so much sense.
Oh, thank
Can
you for that.
can you tell me how faith and spirituality affect stigma associated with mental health conditions and their treatment?
Faith and spirituality, I like to say, can be either a bridge or a barrier to people seeking mental health care. I think first starting actually with the more difficult in terms of faith or spirituality being a barrier to people seeking mental health care. We know that some houses of worship um, actually attribute to mental health problems to spiritual problems, in particular to personal sin or to a lack of faith. And so, unfortunately, some people who are religious or who have attended various houses of worship have had negative experiences with those faith traditions because when they were feeling depressed or anxious or struggling with drug use, they were told that it was their fault because of sin, or they just needed to pray more, or they didn't have enough faith. And so so much of my work has been in trying to reduce that stigma, to create congregations that are bridges to people getting mental health care. And there has been so much work, especially in the last 20 years, that has fostered, faith-based organizations and truly being bridges um, to connecting people to care. So, what part of what we've tried to do as a way of do that, for example, is actually implementing mental health first aid through churches. In partnership with the New York City Department of Health, there was a huge initiative to partner with faith based organizations from churches to synagogues to imams to have these faith leaders on Sundays talk about the importance of mental health, reduce stigma by sharing their story and getting people connected to treatment.
I'm curious, are you seeing, like, being that you're in New York, are you seeing similar things throughout the country, or is it more like regional?
Well, in terms of national experiences with the intersection of faith and mental health, the South, I'm from Virginia, so I'm kind of part of the Bible Belt, which is classically kind of the most religious parts of the country. So that has been, a really important part of this initiative, and really trying to engage people in faith-based settings to reduce stigma and get access to care. Also in California, Rick and Kay Warren, I'm actually fortunate to be a part of Kay Warren's program this weekend that she's having called Breathe. Um, they've been huge advocates in this space in promoting mental health through churches. And because of their reach, it's really taken on an international flavor. So I would say those key areas in the South and Southeast and in the West Coast have been really leaders in this space.
It's so great to hear you're making such a difference. I mean, because you're meeting people where they're at, and that is so important. When people are getting care at church or at their faith-based community, what happens about medication? Like, if they need medication?
That's a wonderful question. So when people in faith-based settings need medications, we've seen various attitudes towards medications. I think some people are hesitant in some faith communities to take medications. So we've developed a series of kind of workshops and seminars to try to educate people about symptoms and severity of mental health problems and when a person would benefit from medications and the importance of discussing side effects with their prescribers, because we know that all medicines have side effects. And so that's kind of the strategy that we've taken. And one of the churches in particular that I'm working with created a freestanding mental health clinic that is staffed by psychologists. We have a relationship with psychiatrists at Columbia where we provide medication management free of charge through our residents, and that's been a wonderful way to provide medications for people who need it, as well as reduce stigma and increase access to those medications.
That's great. I'm really curious. How did you become involved in working with community churches? Where did it all come from?
So I became involved in churches through a combination of kind of personal experiences as well as professional experiences. So on a personal level, I grew up in Virginia. My dad's a deacon at the church where I grew up, a Baptist church in Fredericksburg, Virginia, and my mom played the piano for the little kids choir. So I was in church either singing or trying to sing or attending services. Every week, as a child. And so my faith is very important to me. And through that experience, I saw just how central people's faith were and how central and trusted churches really are as conduits for providing health information. And then professionally, and treated patients either on inpatient units or outpatient units, especially with African American and Latino patients, they talked about the importance of prayer and they talked about the importance of me wanting to connect with their pastor or their clergy person. And so that really emphasized the importance of spirituality and faith in the lives of the people that we serve. And so that's how I've tried to kind of merge those two different aspects through the work that I do.
Amazing. It's so great and so important. I'm hoping that you could describe to us the work that you're doing with the First Corinthian Baptist Church and the Hope Center.
So The Hope Center is a freestanding mental health clinic that was created out of First Corinthian Baptist Church. They provide 10 to 12 sessions of evidence-based therapy like cognitive behavioral therapy, interpersonal psychotherapy, group therapy, and they provide marital counseling free of charge to members of the Harlem community. And people do not have to be members of the church to receive services at the Hope Center. So the pastor and I of the church, he really started the Hope Center because of his own personal struggles, which he's talked very publicly about with depression, as well as seeking a therapist himself, and that really fueled his desire to provide services through the Hope Center. And so now I'm really working with them quite closely to try to expand their capacity because, as you can imagine, people are thrilled at the idea of getting quality care that looks through the lens of spirituality for free. And we're also forming relationships, expanding relationships with Columbia to provide more access to psychiatrists to provide medication management through the Hope Center.
That is so important. And what an amazing thing that they're doing it for free. When we think about psychiatry or medication or even just psychotherapy, it seems like there's been somewhat of a negative relationship between psychiatry and the Black community. Is that true? And if it is, how come that is?
Well, I think the relationship between medicine in general and psychiatry in particular, historically has been a tenuous one. I think generally, because of systemic racism and because African Americans historically were barred access to healthcare services, that has contributed to a tremendous amount of distrust in the Black community with healthcare in general. Other instances, like the Tuskegee syphilis study, where over 300 Black men in Tuskegee, Alabama, were blatantly lied to through a federally funded research study and told that they were receiving free treatment for syphilis, when in fact they received no treatment at all. The scientists just studied syphilis over the life course in these men. That really has created such a chasm between medical research and healthcare in general in the Black community that we're seeing it today. When people are talking about vaccine hesitancy, it's important to contextualize it with the history of the United States government lying to African American men. And so I think it's very important to understand this history with medicine and with medical research in general. It's because of that study that all studies now have to have an institutional review board, which reviews the ethics and makes sure that people know that they're participating in a study voluntarily that emerged out of the atrocity of the Tuskegee syphilis study. So I think that's the first layer of this. Psychiatry in general also has a fraught relationship with the Black community. One of the ways that that has happened is because Black men who have psychotic symptoms are more likely to be diagnosed with schizophrenia compared to white men with psychotic symptoms, who are more likely diagnosed with bipolar disorder or major depression with psychotic features. And so, because of this misdiagnosis, which has led to harsher medications and harsher treatment, that has certainly created distrust with the psychiatric field as well. And I think another factor that's contributed to distrust is that psychiatry, or many psychiatrists, have had I would say, an antagonistic view of people's spiritual beliefs. And given how central, faith and spirituality in the church is in the lives of African Americans, it certainly has created a sense of distrust, I think, with psychiatry and the Black community in general.
Wow, I have to say I'm embarrassed and ashamed and I didn't know about any of that. So that's crazy and that makes so much sense. What do you think could make it better?
Well, I think in terms of addressing the distrust between the psychiatric field and the Black community, I think several things can make it better. One is talking about it. I think to your point about people need to know about Tuskegee. People need to know about the high rates of psychiatric misdiagnosis in Black men. People need to know about the high rates of psychiatric diagnosis in Black boys who, when we look at diagnostically, have PTSD or depression and are more likely than white boys to be diagnosed with conduct disorder. So I think we have to talk about these issues and these racial and ethnic differences in diagnosis, as well as the history of racism as it relates to medicine generally and to psychiatry in particular. I think a second thing that we need to do is to try to form strategic, partnerships with trusted community-based organizations, such as churches and barbershops and hair salons. So I've actually done studies with barbers. When you sit in that barber chair or when you sit in that beauty salon, you have a couple of hours, and those folks are really kind of informal counselors as well. And so leveraging the trust of these community settings, I think will go a long way in addressing some of that distrust. And then I think the third way is really creating spaces. You mentioned cultural humility. The reality is that only 3% of psychiatrists in this country are Black. 3%. And so it's incumbent upon the field to incorporate trainings around cultural humility so that everyone is aware of some of these historical injustices and is attuned to some of these factors that contribute to distrust, in communities of color.
It's such important work, and it's work that could change the world, really, because we have these inequalities, and I think I love the notion of talking about it. I think what's just hard is the where, and then how do you engage people. I mean, I don't know that we know these answers, but how do people start talking about it? What could people do that you found? I mean, you've done a lot, and I think that it seems like everything that you're doing is focused on the Black communities and helping educate them, but there's that whole other side of it, which is the not Black communities that need to understand it. So what could we do? How can we help for everybody that cares and wants to be part of this change?
Well, I think in terms of what everyone can do to address issues around racial injustice and to truly promote equity, uh, 2020 was a catalyst for this. And people are calling 2020 the year of racial awakening or racial reckoning, however you want to call it. And I think, the murder of George Floyd really opened so many people's eyes to what has been known by folks in communities of color for centuries about the injustices and the inequities in the systems that are supposed to be helping us that are actually, in many cases, harm us. And so I think that we are at a critical point in being able to continue these conversations and not let last year just be um, an awareness, but hopefully turn that awareness into action, such that we have these conversations more regularly, and we try to increase our tolerance for discomfort because they're uncomfortable conversations and they need to be uncomfortable. But I think in that discomfort, we can work our way through to a more equitable and just society.
Thank you for all this great work that you're doing. It is so important. We're very focused on evidence-based practices at Psych Hub, and as is Columbia. What are some of the measures that you use to determine the effectiveness of uniting mental health and spirituality?
So that's a great question in terms of thinking about how do we measure the impact of mental health and spirituality. So we currently have a federally funded study by the National Institutes of Health that involves 30 churches in Harlem, and we have recruited and trained community health workers from these churches who are going to be delivering motivational interviewing, which is an evidence-based intervention originally developed for substance use disorders, but we're tailoring it for depression. And we're going to be looking at its impact on clinical outcomes. So, depressive symptoms like the Patient Health Questionnaire 9, the quick inventory of depression, as well as functioning. So, we'll be looking at the short form 12 to see how people are functioning overall at 3 and 6 months after they receive this intervention. And our main outcome is treatment engagement. So, do people actually go get care when they are clinically depressed? Does this intervention have an impact on people actually seeking, mental health services? So, those are some of the outcomes that we're looking at, all of which will be assessed by kind of level of spirituality, which includes church attendance, prayer, frequency of, importance of spirituality, and other variables like that.
I have to think that doing all of that work and measuring those outcomes goes back to changing the paradigm, is that then you can use that and people can use that to share stories to help to prove that that this help does work and it is effective, and that might over time helpfully combat some of that distrust.
Absolutely. I absolutely believe, and the evidence suggests that the one of the most effective ways at reducing stigma is through contact with someone who has had a mental health problem, has gotten treatment, and has gotten better.
Yeah.
So there is strong evidence that those stories move people's hearts and minds in a way that education in and of itself just cannot. And so one of the things I'm really excited about is developing strategies to have people share their stories and to measure the impact that it has on behavior change, on attitudes, and on actually people seeking treatment.
Wow. Well, you truly are an expert, and I'm so grateful to have you on this series talking about these important issues. I hope that we get to stay close and stay connected to you, because you're doing some of the most important work right now that needs to be done, and it's healing, and it's healing, interpersonally, but it's also healing communities, and it's hard. And I commend you for really diving into the hard work, because my guess is that you could be sitting in an office seeing patients and that they're not saying there's anything wrong with people that do that, but there could be you could have taken an easier path, and you're choosing a path to really make a difference and leave a legacy. So thank you.
Thank you, my pleasure, and thank you so much for your kind words. And I think platforms like Psych Hub really give people access to the type of information that they normally wouldn't have. So it's a pleasure to be able to be with you all today.
As always, thank you for listening to our podcast. If you enjoyed the show, drop us a review. If you haven't already, subscribe to our podcast for the latest episodes. For the latest insights, check us out at psychhub.com.